I think one of the great things about Vanderbilt, and particularly our division, is we're able to provide services to a large number of patients and offer very specialized services, but still small enough where we can individualize the care and be attentive to the needs of every patient. My name is Paul Moore. I'm the Director of Pediatric Allergy, Immunology, and Pulmonary Medicine. Coming into a fellowship, it's really coming into an apprenticeship. And in our program, that means you're the front line of the program.
We feel that our training program will be one of the founding features for the next generation of pediatric pulmonologists across this country. My name is Dr. Andrew Sokolow. I am the program director for the fellowship program for pediatric pulmonology at Vanderbilt. You never finish learning, and I think this is one of the foundations of our program here.
In general, we do about approximately 500 bronchoscopies a year, and by the end of 3 years of fellowship, fellows on an average do about 250 plus bronchoscopies. And I think that gets you ready for any program or anywhere in the world to go and do your job as far as the pulmonologist is concerned.
This is a tertiary center, so you get to see everything. You'll get to get exposed to everything.
Our fellows are exposed to cystic fibrosis on the inpatient side as well as in the clinic, and participate in quality improvement and research within cystic fibrosis if that is what they choose.
Our fellows will have exposure from the pulmonary side in the clinics and on the service, and to sleep medicine on the outpatient clinics, and we have a variety of patients and pathologies.
My name is Michael O'Connor, and I'm an associate professor here in the Division of Pediatric Pulmonary Medicine. And my role is the director of the Primary Ciliary Dyskinesia Center. This is an amazing place to practice clinical medicine and an amazing place to do research. And the great thing about being a fellow is that the fellows are very much included in this process.
My name is Eric Austin. I'm a pediatric pulmonologist here at Vanderbilt University Med Center. I've been here since 2005. In my research time, I'm a physician scientist, and I study individuals who have pulmonary arterial hypertension, both pediatric and adult. What Vanderbilt is really good about doing is helping you to choose what you want to do, not what we want you to do. So we have the opportunity to offer you research of really any type that you'd be interested in. This might be translational research, it may be basic science, it may be large database work.
I am Rosa Salazar. I'm one of the pediatric pulmonologists and physician scientists at Vanderbilt. I am part of the Center of Asthma Research, which is a large group of investigators in asthma. We see a lot of kids with severe asthma, so fellows in the field of asthma are able to see everything from the clinical setting moving into the research and the translational settings. The opportunities at Vanderbilt to develop their research skills are second to none. We have training in every aspect of the research.
This institution is very good at empowering people to do what it is that they know how to do and to really function to the full extent of their experience in their practice.
So when I was looking at fellowships, I was looking for places that were large enough that I would see everything, but not so large that I would get lost in the shuffle. And I think Vanderbilt was really the Goldilocks program in that it wasn't too big and it wasn't too small.
I'm really happy that I chose Vanderbilt. I was really drawn to the people that were here. I felt a sense of camaraderie. I felt that everyone was really interested and passionate about what they were doing.
We're not here to just write notes and do work. We're here to learn and contribute to the team. And I also think it's the camaraderie, not just amongst the attendings, but also the support staff, the nurses, the respiratory therapists, the case managers, and the fellows that make this a really unique place to not only work, but to learn.
From a personal standpoint, it's more like a family. My name is Odessa Settles. I'm kind of the coordination for the BPD follow-up program, which is bronchopulmonary dysplasia. We follow infants who have chronic lung disease and still require supplemental oxygen when they are discharged from the neonatal intensive care unit. Our fellows will get a very well-rounded experience.
The thing that really attracted me to this division was the people. Vanderbilt as a whole is such a great community. It's a very collegial atmosphere. People are very friendly, and I think we all want to advance the education of those around us and take the best care of patients that we can, and really take the best care of each other that we can too.
Our goal is that our fellows will leave our program ready to pounce on whatever it is that they want to accomplish immediately without needing to reset and pivot to a new experience.
So I think after completing fellowship at Vanderbilt, I will be very poised to go anywhere and do anything within the world of pediatric pulmonary.
We're a diverse group, and so we bring that diversity together, and I hope that you'll learn from every single one of us. That's part of the strength of our fellowship, is that you're going to be exposed to different approaches to a lot of different diseases. And for those who come here for fellowship, I hope you'll leave and just be enriched for your experience here.